Welcome to the Erie Wellness Podcast, your go-to source for all things health, wellness, and living your best life right here in Erie. I'm your host, Lauren Brunetti, and I'm so excited to have you here. Each episode will dive into conversations with local experts and wellness professionals who are making an impact in the world of health and well-being. Before we jump in, be sure to like, share, and comment on this episode. We love hearing from you and seeing our community grow. Now let's get started. Welcome to the show. We are really excited to have Michelle today, a NetworkSpinal chiropractor specializing in optimizing the nervous system for better physical, emotional, and overall well-being. She's also passionate about clean living and helping families make healthier choices. As a mom of 2 little ones, Michelle understands the importance of holistic wellness. She hosts free self-care meetups in the Lafayette, Erie area and is launching a wellness moms group to support healthier lifestyles. Get ready for an inspiring conversation today. Welcome, Michelle.
Thank you. Thank you so much for that great intro.
We're excited to have you on. So you live here in Erie, correct?
Yeah, I live here in Erie. I've lived here for the past few years. I love it. I love that I get to raise my kids here.
Awesome. Well, to kick things off, can you tell us a little bit about who you are and the work you do, as well as the types of people you typically work with?
Yeah, sure. So as you mentioned, my name is Dr. Michelle Green. I am a NetworkSpinal chiropractor. This is a little bit different than conventional chiropractic. It's using really light, gentle touches to help unwind the nervous system. So it's really nervous system focused, and it helps we can work with all ages and stages. It's very gentle and effective and safe for anywhere between newborn babies, children, pregnant moms, older patients, and everyone in between. In fact, I am trained in the specific technique called NetworkSpinal, but I also have other trainings in special populations such as pregnancy and children chiropractic. And so I kind of combine all of that and personalize the care for whoever I'm working with. I had this patient who I would love to share really quick, but she came into my office. This was last year, and she had just had her second kid. She was crying in my office, really dealing with a lot of anxiety, some depression, pain in her body, and she really wanted to get back to dancing. And so we started working together, and a few months later, she comes into my office. She's like, my pain is completely gone. I feel so much better. And I just scored a role in a play, and I'm going to be dancing again. And we joke that she has her sparkle back. And that's what I love to do, is just help people get back into doing what they love and being who they want to be. And so I work with people who have pain, often chronic pain. I work with people wanting better emotional regulation. Some people want to work on releasing maybe trauma that they feel might be stored in their body. And some people come to me as well to work on the whole family. So I work on children, kids who are on the spectrum, neurodivergent, and just help gain better regulation. So this work is really gentle, safe, and effective for all ages and stages and populations.
I love that story. That's fun. I feel like, especially as we get to midlife, we feel like we lose that sparkle because we're starting our careers, we're starting our family, and we're just in the grind. So when you can find things that bring out your creativity and just make you feel like yourself again, that's really inspiring.
Yeah, absolutely.
What do you love most about being a part of the wellness space here in Erie?
Honestly, I think it has to be the people. I've lived here the few years, and I've just seen how this community comes together to support one another, especially if someone's in need. I've seen it firsthand. And I mean, I'm in my neighbor's office right now. They're letting me use their little podcast setup. Everyone's just so friendly, so neighborly. And I haven't seen that in anywhere else that I've lived. So I'm grateful for all the people here.
I agree. I feel like the people really make the community, and even just getting the opportunity to start the podcast. I feel like everyone has just been really excited for me, and everyone is wanting to be on, which is really exciting. I was like, I hope that people are interested in sharing their story and what they do, and just supporting the community here as well. So
awesome. I love that you're doing this.
You specialize in nervous system regulation through the NetworkSpinal method. Can you explain what that is and how it helps people achieve better health?
Yeah, good question. So I focus on the nervous system. And so each and every cell in your body can be traced back to one of the nerves in your neurospinal system. And so making sure that's optimized, it's vital to good health. It makes your body parts move, your organs work. We perceive the world through our nervous system. And so when stressors happen, physical, chemical, emotional stressors, it puts our body into fight or flight. Now, that fight or flight, it's important in that moment, but if we're overwhelmed with so much fight or flight or so many stressors, we can go into that place of fight or flight, and that place can be our new baseline. And so, helping to allow the nervous system to go into rest and digest, which is the other side of the nervous system, that's where healing happens. For kiddos, that's where development happens. Allowing us to access more of that, access safety, let our bodies know it's okay to relax. Our body is able to unwind from these patterns and create a condition where optimal healing can happen. So, a great quote I love is the shape, position, tension, tone of your spine is the shape, position, tension, tone of your life, because the way in which
Hmm.
our nervous system is, and you can see it with body language, right? Like having your shoulders back and you can try it at home, like changing your body position is changing the way in which your spine is positioned, which is also houses your nervous system, and it changes the way we feel, the way we perceive the world around us, our physiology. And so they've actually found, there was a study done of over 2,800 people, and they found that this type of work, network spinal, which helps to unwind the nervous system, unwind patterns that we may no longer need, help optimize all of that, it creates quality of life changes. They found that it created better emotional regulation. They found that there was less pain, people had better physical bodies, less better life enjoyment, and then more stress resilience. So those four categories, there was significant changes in all of those. And so that's what you can get when you have a healthier nervous system, just having a better quality of life and being able to, like that example, dance again or do whatever it is that you want to do. So that is what I do.
It's so interesting.
Mhm.
I've also heard you mention the concept of these lifestyle traumas that we experience that we don't even know that we're experiencing. What exactly does that mean, and how can things like physical micro traumas, exposure to things like chemicals, or past emotional experiences affect our nervous system?
Yeah, great question. So we often think about these big stressors like, a car accident or a big fall or a big chemical reaction we had, or maybe a huge emotional thing that happened in our life. And those are what really not define us, but create a huge impact. But we often overlook these little micro traumas that happen on a day to day basis that maybe it's a small thing, but when it adds up, it becomes a big thing. For instance, sleep. Sleep, we spend a third of our life sleeping. So the way in which we sleep, the sleep position, all of that adds up. So physical stressors can be how you sit in your chair, it can be how you sleep, things that add up like that, looking at our phone all the time, chemical stressors. That is starting to get more attention, but also I feel like overlooked. So like what cleaners are you using, synthetic fragrances, microplastics is a big one, things like that, just adding up with products that may not have ingredients that really work with our body. And
Mhm.
then emotional stressors, like I see it all the time in my office, like a stressful job or something that maybe it's not like one big, huge thing, but it's day to day stress where your system has to be on all the time. And so when these stressors are happening, our body feels like it has to go into defense mode. And if it's in defense mode, it can't heal. It's kind of the opposite. So when you're in fight or flight or your body feels like it has to defend itself, it actually makes changes. So it shunts blood away from our organs. It can affect digestion. It can affect our hormones. It can change our breathing. The blood goes all into the muscles. Your body thinks it's being like chased by a tiger or something, but really it's just an email from your boss, but we have the same reaction. So small things add up and can create a big impact.
What are some symptoms or common symptoms that you see people come in with that you can tell that they've just been, their stressors have just been slowly accumulating and then they kind of hit a breaking point?
Yeah. So oftentimes I do exams in my office that really show objective measurements, but we'll see in posture. So this is like a protective posture. They found there was a neurosurgeon in I think it was 1930s or 40s, that actually found that the state of our nervous system changed the way in which our spinal cord was positioned. And so this is more of a protective posture where you have your shoulders forward, your head is forward, whereas being open, that is, your system just feels like it can be in that space. It's like that real, there's nothing wrong with type A personality, but it's that personality where you can't really shut off. Like you're not comfortable being still. You're uncomfortable with stillness, or it doesn't feel safe. All of those things and pain in the body as well. Like when you're in fight or flight, your pain receptors are definitely going to be just on overdrive. There's going to be more inflammation, things like that. So your body, it's not a condition or a place where healing can happen as easily.
When someone comes to see you for the first time, what does that visit look like? And I know you use history, like you said, and then you also talked about EMG equipment to assess. But can you walk us through what a typical first visit involves?
Yeah, sure. So the first visit's about an hour. And in that hour, we talk about, well, first, I want to connect why that person wanted to come in the first place. Of course, we talk about any past traumas, anything that might be important, major accidents, injuries, and then also their health goals. Where do they want to go? How can I help them? Can I help them? Is it a good fit? And then we go ahead and do the exam. So the exam, we do 5 different things. So first, I start off by looking at the posture, because the posture and the way in which the body is positioned is like a window into what's going on with the nervous system.
Mm-hmm.
And then we look at, I have 2 weight scales, and I have the person put one foot on either side, and I'm actually seeing how that person is distributing their weight from right to left. And within a couple pounds is good, but I sometimes it's surprising. Sometimes I'll see 5, 10, 15. I've even seen up to 30-pound difference from side to side. So imagine how that's affecting that person and how that would be impacting how they feel in their body.
Mm-hmm.
And then I have 3 computerized scans that look at the nervous system in 3 different ways. So you talked about EMG, and EMG is great. So that's one of the scans. We look at, are the muscles overworking, underworking? Are they balanced, imbalanced? So it's picking up electrical activity given off by the muscles. If for some reason you're just sitting there while I do the scan and those muscles are overfiring, they should be within a certain range. That tells me that something is misfiring. There's something going on. Another scan we do is called the neurothermal scan. So it's actually picking up skin temperature along that person's spine. Anything outside a half a degree difference is showing me that there is, again, something is misfiring, something's going on. Mm-hmm. And the same part of the nervous system that controls skin temperature controls all the parts of your body that happen automatically. So blood chemistry, organs, and then finally we do an exam called heart rate variability, which there's more and more research on heart rate variability. But this is really cool because we get to see, it's picking up your heart rate, heart rhythm, and from that information, it can tell us where that person is as far as their baseline. Are they more in fight or flight? Are they more in rest and digest? How resilient are they to stress? People who have a lower score are more prone to like chronic illness and things like that. And then finally, they'll get their first NetworkSpinal session. And then based on all those things, I'll be able to give a personalized recommendation, whatever that person might need. So that's what we do in that first visit. And it sounds like a lot, but we fit that all within about an hour. So it's
That's
fun.
so cool how you take all of those different points and kind of put a story together for the patient and help them really understand where they're at with their health, looking at different things.
Thank you. Yes, it's cool.
So what happens? Okay, so you have the initial visit, but what happens in the follow-up visits? And I understand that this is when you focus on retraining the nervous system. And how does that process work?
Yes. So that first visit, I'll give that personalized recommendation based on where their nervous system is. Then we'll create a plan. And that plan is basically telling us like how often that person might need to come in, what that looks like. Follow-up visits are anywhere between 10 and 20 minutes, and we do network spinal session. And I like to think of it kind of like if your hand, so Lauren, if you were walking around with your hand in a fist, for instance, and you didn't even realize your hand was in a fist, that was kind of just your normal. And I was like, hey, Lauren, do you realize your hand is in a fist? You might not realize that, and you'll open up your hand. By the end of the day, your hand might go, it probably will go back into a fist because that's just how your body's wired. But if I keep reminding you, eventually you'll hold your hand back open. That's what we're doing in the office during our sessions, essentially. I'm sending gentle reminders, gentle wake-up calls to your brain, letting it know that, hey, it doesn't have to hold these patterns anymore. It can relax, it can change those patterns, and we really work on reorganizing those patterns. And so it does take, there is a process. The process looks different for every person. We do these exams throughout care just to make sure we're on the right track, we're not missing anything, but that's essentially what those follow-up visits are like and what they're for.
Okay. Are you meeting people with once a week, or does it really just, is it based on individuals and what their needs are?
Yes, it's very much based on individual needs, anywhere between 1 and 2 times a week. Just depends. Yeah.
And how long does it take to retrain your nervous system?
That also depends. It depends on how much maybe trauma the person has gone through, like if major accidents, injuries. I've seen people who've gone through really major stuff, but like also they've changed really fast. It kind of just depends. It kind of depends on what's happening outside the office as well. If the environment outside of the office is being supportive of that as well. And once we kind of get through that initial part of care, then it's like, okay, you can do this maintenance. A lot of people choose to kind of come in maybe once or twice a month just as a maintenance type of thing, but also it's kind of a choice whether you want to incorporate that then into your self-care kind of routine. Yeah.
That makes sense.
Yeah.
So are you in those follow-up visits, are you doing chiropractic treatment, like making adjustments as well?
Yes. So NetworkSpinal is a chiropractic technique, and I'm trained in about a dozen different techniques. NetworkSpinal is the primary one that I practice just because how much of an impact it made on my life. But I will throw in whatever else is needed. But the whole thing is basically a chiropractic adjustment, but there's no popping or cracking like a conventional adjustment. So it's a little bit different. However, people do report over the day or two after, they'll notice like a big pop or crack in their body as if they were getting adjusted by like conventionally, but it's their body's doing it on its own. So
Okay, that's very interesting.
yes.
So what are some things that you are encouraging your patients to look at in between sessions? So maybe exercises that you're having them do, things that you're looking at in terms of lifestyle, and starting to just slowly make changes as you're working with them.
Yeah. So great question. I really want to and really like to empower my practice members to see what may be contributing to their nervous system and stressors and patterns that are happening within their system. So as I get to know them, as I get to know what's going on in their system, we can start having conversations about, okay, are your adjustments holding? Are things going the way that they should as far as progress? Maybe there's something at the house or maybe in your life that is really not helping the your nervous system get into that place. And I will say I've noticed it kind of happens naturally. The more in which we work together, I see people making those changes on their own. Just because their nervous system is in a healthier place, they become more aware. They're able to kind of look at these things in a bigger picture. But I like to educate my patients on different exercises. I actually teach classes on something called somatic respiratory integration. So it's using body breath connection to just create more connection with the body and not see it as like an adversary, but instead of as an ally. And it's using breath and sound and the way in which we can change our nervous system at any moment is breath, sound, or movement. You can move, you can make sounds, you can change your breath, and that's all going to change your nervous system in the moment. Things like cleaning products, things like synthetic fragrances, like we talked about, those chemical part of the microtraumas that seem small, but they add up. And there's so many in just day-to-day life now. Those are really good to switch out too. I try to encourage people to just at least become aware, and then it's up to them if they want to make that switch. It's hard sometimes to just, go all it's really tempting to say, I want to just switch everything right now. But even me, like, I feel like I'm still ongoing, right? Like it's a huge process. You make one switch here and then you kind of realize, oh yeah, and also my cosmetics aren't the cleanest. Maybe I'll switch that out and find a better alternative. So it's a step-by-step process. And so I don't want anyone to ever feel overwhelmed by it, but I do love it. And I'm always there for people who are ready to make different switches in different areas of their life, especially the chemical part. And then I also educate about sleep and what's a good sleep position. Because as I said, 1/3 of your life we spend sleeping, and just helping people have better emotional regulation as well. So,
what are some sleep tips that you have for us?
ooh, good question. So I always say, I think sleeping on your side or your back is great. When you're sleeping on your back, you want to make sure that your chin isn't like tucked. So making sure that your pillow isn't like too thick. You never want to use more than one pillow. And then having a pillow under your knees is great. As far as side sleeping, a pillow between your knees, I recommend. That way your hips aren't all weird. And then your pillow, so I like to curl up in a little ball. It's not always the greatest, but when you're on your side, just trying to kind of have a little bit more extension. So, not having your head tucked down. And then your sternum. So your sternum is that bone right in the middle of your chest. Your sternum and your nose. So this is how you know if your pillow is too big or too small. When you're on your side, you can have a friend or your partner or whoever kind of look and see, is your sternum and your nose lined up, and does it make a line that's parallel with the floor? And then that way your head is not, too up or too low. Mm-hmm. So those are my sleep tips.
Okay. I haven't put a pillow between my knees since I've been pregnant, but it's something to think about. I do sleep on my side and I normally kind of curl up too, but maybe I'll put a pillow under and see.
Yeah, try it out. Let me know.
Can we talk a little bit about kids' health too?
Yeah.
As a mom of 2 young kids, what are some common things that people are bringing their kids in with and how you can help?
Great question. Yes. And I have a 1.5 and 3-year-old myself. So kids, when their nervous system is not doing, I don't want to say not doing well, but when their nervous system maybe is in more of a stressed place. And sometimes it happens even from birth. Birth can be, if it's not a birth that is optimal, that's a lot of pressure going on the cervical spine of that little kiddo. And so for little babies, that can look like colic. That can look like emotional dysregulation. Of course, kiddos don't know how to regulate their emotions, but maybe it's just really more than kind of expected, but it can help the kids with that. Ear infections is another one that people don't really think of. Digestion. I have just the other day, a little girl in my office, and it really helps to allow that digestion to work. So kids who are dealing with digestive issues and not able to maybe go to the bathroom or have some fears around that. I also work with neurodivergent kids as well. And there's a lot of research connecting the immune system and the nervous system as well. So just overall health, wellness support. My kids are so funny. I didn't have chiropractic parents, but when my kids like fall, they'll cry. And then in the midst of their crying, they're like, adjustment, adjustment. And they'll like pull me to the table and like make me adjust them. So they know when they're out. Kids are just so smart that way, but it really shows up differently in kiddos. They don't have like the back pain or the neck pain that us adults get.
My kids, they get monthly adjustments, but if
Right.
we're dealing with colds or sickness, I usually bring them in a little bit more to help with that. So why do adjustments help when kids are not feeling well?
Yes, great question. So there's a new, I guess it's more new, a lot more new research on neuroimmunology. So the connection between our nervous system and our immune system. So when we get adjusted, when we're sick, it can really help just one, get our body more into that healing place because our body is working so hard when we are sick. So it helps to align the nervous system so that we can be more in that rest, digest, heal, develop state. And then also it helps to just having, especially that upper cervical, the brainstem sits right there. It's connected to eyes, ears, nose. It's very connected with the immune system. So having all of that in an optimal place just supports the body's natural ability to heal.
You mentioned digestion, especially with little kids. I know that I've talked with other moms too, and there's been times even where I've had friends bring up that their kids are dealing with whether it's constipation or tummy troubles or whatever, and they immediately kind of think of diet and how we might need to switch up things, whether it's like a gluten intolerance or maybe dairy that's irritating their bellies. But can you provide some like just things that you need to be maybe asking yourself in terms of what other things could be going on with your kiddo as well?
Yeah, great question. So the nervous system, we have fight or flight and then rest and digest. So if that nervous system is in fight or flight, we're not going to be able to digest as well as we should. As you know, I have two kids, and yes, it's important to watch what they eat, and maybe there are some intolerances there, and that's really good to be aware of. And sometimes the nervous system can also be affecting digestion as well. Um, the sacrum, kids fall. I don't know. My kids fall like 100 times a day. My son has bruises on his face and he's just falling all the time. And they're growing and they're developing and they're learning and they're figuring out all these emotions. And so there's a lot of stress being like a little kiddo. And it's natural. Our bodies are meant to, respond to these stressors and reset from them. But if there's a lot going on, sometimes it just needs a little bit of help. And so really safe, gentle, effective adjustment, which honestly is just the amount of pressure that you put on like to check the ripeness of a tomato. Like it's very little, but it's so specific that the body is able to respond, and kids change so fast. So yeah, I would definitely consider chiropractic as a possible solution. And it's amazing how quickly kids can adapt just because their systems are ready for that change. So it's a good
Right.
thing to consider.
We've been told that our kids are so resilient and adapt to change very well. It's just, helping them through that
Exactly.
change as well.
Exactly.
So you also provide a lot of education to your patients through email and patient modules. And you also offer free educational classes. How do you feel like this ongoing education helps patients take control of their health and support the work you're doing with them outside of their, just normal visits?
Yeah. So I believe it's just so important to empower my practice members, especially as they're going through care. I do provide email modules that I've created. There's videos in there. Some of them are just text. Some of them have exercises or breathing exercises. And they get these modules every about 5 days. And it's just helps people feel more empowered. It educates about the stressors, the chemical, physical, emotional stressors that we go through. It educates about the nervous system, things we can do outside of the office that even just take just 1 minute that we can do to affect our nervous system. And so I really find it important to have that and create an empowering environment. And then also I do community classes, free classes that my practice members are always welcome to. And then those are also open to the community as well. As I mentioned, just body breathwork exercises and things like that, so that people can just feel more connected with themselves and be able to be an ally with their body and with their nervous system.
Mm-hmm. All such good information, and I'm so excited that you're, doing that community outreach, because it's proven over and over again that community is also a huge aspect of our overall health and well-being. So,
Yes.
thanks for doing that so much. It also, when you were talking, it brought up, it's really about consistency, right? It's not about the amount of time, and you're not asking your patients to spend, that much time, but it's the little things that we can do throughout our day. What are some small things that you encourage your patients to do just every day that are going to make a huge difference?
Yes, great question. I would say awareness is key with this. So being aware of how our body is when we're looking down on our phone, when we're in our bed going to sleep, where is our body? What are we doing? How can we support it? There's a really simple exercise that everyone can do, and it takes 1 minute, but our breath, when we're in fight or flight, our breath automatically goes faster. And so one thing we can change at any moment, at any time, is the speed of our breath. We can also change how we're positioned. We can change how we're moving. And we can also make sounds or speak up. We can use our voice. So those are 3 ways we can impact our nervous system at any moment. So just taking a minute every day to slow our breath down, just slowing down, slowing our breath. Most people breathe between 12 and 18 times per minute. Maybe just set a timer for 1 minute and just breathe, where your exhale is just as long as you can go. Maybe you can even add like humming with it, which stimulates the vagus nerve, which is a whole nother topic.
Mm-hmm.
But try to breathe like 5 to 8 times that minute. See if you can slow your breath down. And just that awareness, even for 1 minute a day, I think it makes a huge change in this fast world that we all live in.
So it's not really about the quantity, it's about the quality of your breath throughout that minute, correct?
Yes, absolutely. And just taking that moment to be present and tuning in. Mm-hmm.
Okay, sounds good. Okay, for those interested in working with you, what's the best way to get started?
Yeah, so for anyone that wants to work with me, you can go to my website, www.thewellhealingcenter.com. You're also welcome to call or text me. My number is 720-722-1622, and that's the office line. So if you have any questions or anything came up during this, feel free to reach out, and I'd love to connect.
Michelle, thank you so much for joining us on the Erie Wellness Podcast. Your passion for holistic health, nervous system care, and as well as clean living is truly inspiring. I love how you're creating opportunities for connection and wellness in our community, from your self-care meetups to your new wellness moms groups. And to our listeners, thank you for tuning in. If today's conversation resonated with you, be sure to connect with Michelle and check out the amazing work she's doing. That's a wrap for today's episode. Thank you so much for listening to the Erie Wellness Podcast. I truly appreciate you being a part of this journey. If you loved today's conversation, don't forget to subscribe, leave a review, and share it with a friend. For more daily wellness inspiration and behind-the-scenes content, be sure to follow me on Instagram at the Erie Wellness Podcast. I can't wait to connect with you again soon.